Welcome to the third lecture of the joint MGH-BWH Radiology Diversity and Inclusion Week. My name is Tanya Day and I'm the co-chair of the MGH Radiology D&I committee, and it's my pleasure to do the introduction for the third lecture in this series. So just to go over our agenda for today, Joy Williams will do the speaker introduction. This will be followed by our keynote address by Mr. Harold Roy. This will be followed by a Q&A session, and I want to encourage everyone to submit their questions in the Q&A tab at the bottom of your screen. To remind everyone, we have an excellent lineup of speakers this week. Tomorrow, we're going to be having a lecture on engaging diverse patient populations by Jonathan Jackson. And on Thursday, we'll be having a lecture on combating discrimination and a review of the new APDR D&I curriculum by Dr. Kagetsku. And on Friday, we will be hearing about the Vanderbilt experience with D&I with a talk by Dr. Bradshaw. And just a few housekeeping items. For any physicians attending, you can use this code VAVTEQ to claim CME, and any of the techs and nurses can go to our website and fill out the CME, continuing education forms to receive CME or continuing education credit for this lecture. And without further ado, I'll turn it over to Joy Williams, who will be introducing our speaker for today.
Thank you, Dania. So it is my sincerest pleasure to introduce to you this afternoon Harold Roy, whom I've had the pleasure of getting to know by way of taking one of his disaster training classes and by being in attendance with him at a Thomas Durant Fellowship fundraiser. Harold is a first-generation Haitian American. He graduated from Plymouth State University in 2005 with a BS degree in criminal justice and associate's degree in French. In 2010, Harold went on further to obtain his master's degree in healthcare administration at Cambridge College. Harold is also the co-founder and executive director of EPE Care, Inc., which is a Boston-based nonprofit organization whose mission is to empower those that live in resource-limited communities to save lives during disasters. Harold was visiting family in Haiti when the catastrophic earthquake occurred in 2010. This unfortunate experience is what sparked his newfound passion in working to help rebuild the country. Through Mass General, he was awarded the Thomas F. Durant Fellowship in Refugee Medicine, which allowed him to return to Haiti in 2011. During this time in Haiti, Harold worked as a security advisor for the American Refugee Committee in 2011 and as a security consultant for Partners in Health and at Mirabales University Hospital in 2010. Harold, we're looking forward to hear what you have to say, and share what all of us, so help us know how we can get participating in humanitarian mission. Thank you, Harold.
Well, thank you, Joy, for the wonderful introduction. I also want to thank you and the entire diversity event work group for reaching out and having me part of today's panel discussion. And to those of you that tuned in, I want to thank you for choosing your Tuesday at 4 p.m. to be a part of this. I'm hoping that what I present today will be an inspiration to everyone or anyone that's interested in this field to take that step and be that change that this world so desperately needs. So in putting this presentation together, I had to come up with a title. And so my title for today is Strengthening Collaboration of the Diasporas and Humanitarian Response: the importance of partnerships, capacity building, and coordination. Before I kind of go into detail of what I do for EpiCare, I think it's really important to know that a lot of what I do or could do wouldn't be possible if it wasn't for partnerships. If it wasn't for culturally sensitive curriculums and programs and coordination, right? Something that was very lack thereof when the earthquake in Haiti took place. Next slide. All right, so just kind of go off of what Joy had done as far as the introduction. I've been with Mass General Police and Security for about 14 years. I've served in the capacity of Special State Police Officer for about 10, and now I'm a security officer over at Assembly Row, the new MGB headquarters at Somerville. I've been there working on the overnight shift for about 3 years. In that capacity, as mentioned before, I am a security trainer. I do teaching in MOAB, managing aggressive behavior, handcuffing, and CPR and basic first aid. And a lot of these skills that I do here in the States is what I do also in my community, and I do it in a way that is more or less culturally sensitive. All right, so a little bit about the agenda. I'm gonna share with you a little bit about my story, my journey as a Haitian diaspora working in the field, I think, yes, I was in Haiti when the earthquake took place, but my journey kind of took off a little bit earlier than that, and so I'm happy to share with you my journey and my story, and hopefully to inspire most of you to kind of take up the field of humanitarian response. All right, and then talk about the birth of EpiCare, what sparked EpiCare, what we're doing, what we did then, and where we're at now, and kind of share with you guys my secret sauce. All right, my secret sauce as far as our successes, our collaborations, our partnerships established, and so forth, and talk a little bit about the overview of the diaspora community and its importance to the global disaster response. We'll talk about a little bit about the negatives and the positives as far as how it's perceived as far as these big NGOs involving diaspora. And last but not least, we'll talk a little bit about the resources that are available to you at Mass General, something that I've learned to appreciate during my course of developing EpiCare and having the impact that I have in my community. Next slide. And so I'll be sharing a lot of terminologies that are familiar to the humanitarian response world. And so a few of them, I think it's very important for you guys to understand what a diaspora is, as opposed to what an expatriate is. All right, and so just knowing these terminologies, I'm sure if you guys have questions as the presentation goes on, I'll be more than happy to elaborate. But these are definitions definitely I'll be using, or terminologies I'll be using throughout the presentation. Next slide. And so my journey, my story, I'm going to say I'm a very proud Haitian American. I'm first generation, which means that my parents who migrated from Haiti came to Haiti and migrated to Brooklyn, New York, in the late 1970s, which is where I was born. We quickly moved over to Boston, where I grew up in Hyde Park in Mattapan. And so I think my story is kind of similar to a lot of first generation diaspora, is that, my parents wasn't really home to do the childbearing. I was raised by my grandparents, more or less by my grandmother. The picture that's over to the right, no, it's not a mistake. And there's two of the same pictures, but one of them is the real original picture. And the other one is actually a picture that I had a portrait of an artist paint up when I was in Haiti. And so the significance of this picture, before I get into that, a lot of what I know of the Haitian culture and who I am as a Haitian American comes from my grandmother, and so with her, she taught me a lot about Haitian history, our family tree, where we're from, and how we came about migrating into the U.S., and also the language. My grandmother really didn't speak English, so I was the one that was doing a lot of the translation. And so that's how I learned to appreciate the Haitian language. And so the significance of this picture was one day we were walking from church, and so we were talking about Haiti and how, Haiti used to be a beautiful place and how it was lovely to live. And all of a sudden, when there was some dictatorship as far as Papa Doc coming on board, we were forced to flee. And, I was really fascinated about the stories that she shared and some of the family members that were left behind in Haiti and all the names that she shared with me. And I remember a promise that I made to her that day with everything that she shared with me. Was my promise to her was that one day I would go back to Haiti and help build back better, you know, because a lot of the memories that she had, although some of them were good, a lot of them was negative as far as, you know, civil unrest, lack of access and resources to healthcare facilities and so forth. And so to me, I thought the best way to kind of help out was for me to grow up, get the education that I got, and be able to go back. And unfortunately for me, January 9th of 2010, I went to Haiti for the first time. And that first time was due to the death of my grandfather. And so I was there for 3 days. So after burying my grandfather, spent a lot of time, you know, kind of touring Haiti where we lived and visiting the country and seeing it for firsthand what it was all about. And with that experience, I kind of fell in love with Haiti, and I really wanted to come back, which, you know, on the day of January 12th, we all know what that day was, which is when the earthquake had hit place. Go ahead to the next slide. And so, so yes, I was there. I was at the airport getting ready to board my flight and leave. And right when we were getting ready to board, you know, the earthquake struck. A group of us made it out to the tarmac. It was until after several aftershocks that the American Airlines decided to take the remainder of people who were on the ground to go back to the U.S., which was Miami at the time, to kind of you know, get out of harm's way. And so for me, it was a very tough decision getting on that plane. I still had family down there. My mother was still down there, my uncle and some immediate family members. And so getting on that plane was probably the toughest decision ever. But when I did make it and got to Miami, there was no way for me to come back. And so I had to go further out, which was go back home into Boston. And so for 4 days, I lost communication and really didn't have any contact with the family that was on the ground. And so with that being said, you know, that kind of triggered me of trying to go back and help out. And so after all said it was done, I kind of spent, I think, I want to say countless days in trying to research and looking for ways to go back in country and actually help out. And I stumbled across this fellowship called the Thomas Durant Fellowship. You can go to the next slide, please. The Thomas Durant Fellowship, those of you who do not know Mr. Durant was a medical doctor at Mass General who dedicated his life basically traveling to, you know, disaster-strict areas of the world and doing a good deed and helping out. And so when he passed of cancer, his legacy lived on, and they named a fellowship after him. And so when that fellowship came about, actually first was exposed to the fellowship, I was actually sitting at a conference. A gentleman that was speaking was talking about the cholera outbreak, and he jokingly asked if there was someone that was interested to go into Haiti, and I just raised my hand. And to make a long story short, I applied. I became the first non-clinical staff to be deployed to Haiti. And so in 2011, I obtained my fellowship, which lasted me 6 months in Haiti, 2 months where I worked with the American Refugee Committee and worked as a security advisor. And for 4 months, I worked with Partners in Health and at the Mirabale Hospital as a security consultant and an advisor. And I want to say that both working with both organizations opened up my eyes as to what was going on in Haiti. At the time, there were a lot of NGOs. Actually, Haiti was recognized as the NGO Republic of NGOs. And so to my amazement, there was so many NGOs, but there was a lack of coordination, a lot of people replicating, doing the same thing. And so that kind of frustrated me. And so I spent a lot of time just kind of really figure out what it was that Haiti needed. And for me, in my exposure to what I was doing at Mirabale, which was teaching and instructing in basic CPR and basic first aid, I collaborated with Ernst Montalban, who's also the co-founder of Epicare. He also is the security director for Partners in Health, and we kind of collaborated and kind of hit the ground running when it came to establishing a curriculum that was culturally appropriate, but also sustainable for those who are living in country. And so with that approach, I was able to come back home. And next slide, please. And we came up with EpiCare. EpiCare is an abbreviation. It's actually called Emergency Preparedness, Engaging Community Action Through Resources and Education. And our main goal is to empower individuals saving lives. Like I said, my experience in Haiti, I was just kind of taken back as far as like what a lot of these NGOs were coming in and doing, which was basically putting on a temporary Band-Aid and actually leaving, which did more damage than it did good. And I was just kind of heartbroken by that. And so, you know, my new passion then was just to kind of do something about it, which was, for me, using what I acquired at Mass General as an instructor, taking that program and converting it into something that was culturally appropriate and training the staff, anyone actually that was in country. So in 2012, we became a nonprofit organization recognized for our 501(c). We were featured in Globe in 2013, which was a cool experience. They came down and did a story and followed us around. And in 2016, we actually acquired land in Accra, Haiti, to help build this a training facility. And what you're looking at on the right there are basically the blueprints of what this facility will look like. Well, it was supposed to be 2020, but with the COVID, everything came down to a pause. But through our partnerships that we've established with EYP and Salmon House, we were able to establish a blueprint of this facility, kind of, you know, which kind of, you know, well, it came to a pause, but at this facility, it was a three-pronged approach. One would be used for education, two would be used for a primary care facility for mothers and children, and three would be used as a command center for a natural disaster if there were to be another one to strike. Next slide. Again, a lot of what I'm sharing is just kind of an example of what we've been doing, and you know, kind of highlight a lot of our successes as far as, you know, Diasporas, like having work and doing great work in the field. You know, we were fortunate enough to, well, I'm fortunate enough to work in the facility at Mass General, where there's a plethora of resources, you know, a lot of subject matter experts. And so they wasn't hesitant as far as opening their doors to me and allowing me to tap into their field of work. And so with that being said, we were able to establish a global health trainer program, which allowed nursing staff at Mass General to be trained through our program and then to deploy to Haiti and train other community members, and those community members would use those skill sets to go train their family members, which was key when it came to sustainability. And so we deployed to Jacmel. We traveled up and down the south coast of Haiti, and it was a wonderful experience. Also, we've hosted Haitian natives to come down and take part in the Harvard Humanitarian Initiative, which is also through a partnership with the Mass General Global Health Department, where we've had people, students from Haiti come down and take part in these exercises, and which was a wonderful experience. Next slide, please. Also locally, we've also launched our 2019 Junior Responder Program. We work closely with BAHEC, the Boston Public Health Commission, with their students as far as having subject matter experts come in, teaching them basic first responder, and hopefully opening the doors for them when it came to their career, right? And so we've had success with that. And then we had our EpiCare internationally. We've been international, where we've worked and collaborated with Project Hope, deployed to the Bahamas to provide local Haitians with basic first aid. We've traveled to Costa Rica and also shipped medical supplies to both countries, Bahamas and Haiti, when in response of the Hurricane Dorian and Matthew. These donations of mattresses were actually donations from partners, and they were put into good use once they made ground in Haiti. Next slide. So what are some of the benefits of the Diasporas group? All right, so there's the obvious, right? The Diaspora groups have access to areas where international communities cannot reach, right? So it's very important that when NGOs do come down and do work, that they reach out to these grassroots organizations and kind of collaborate with them, and so that they ensure that they're reaching out to the people that really do need the help that is in result of the disaster. Political unrest, natural disasters, and armed conflict can be stumbling blocks for NGOs that do come in, but Diaspora are the people, or sometimes the individuals, that navigate those situations. And so establishing those relationships with the nurse Montalban, who is the country director in Haiti, are key when it comes to getting stuff done and getting things accomplished. The Diaspora tend to remain more active for longer periods of time. So when the disaster is all over, the Diaspora are still on the ground and they're building capacity. They understand the culture, and hopefully the program is sustainable. Next slide, please. What prevents an NGO from working with Diaspora? So just know that humanitarian principles, there are humanitarian principles within the NGO that they need to adhere to, and that it helps them to be legitimate and accountable, right? And so those 4 principles are neutrality, humanity, impartiality, and independence. And so the only thing that prevents a Diaspora from working with these big NGOs is that the Diaspora don't really have to abide by these principles. And so that can make it a very tricky, slippery slope when it comes to establishing that partnership and building that relationship, so that whatever it is that they're trying to roll out is sustainable, is received well by the community. Right? But, next slide. So how do you get involved? I mean, like I said, I don't want to say that the path that I took was probably the easiest or the best path to take, but we work at a facility, at Mass General, one of the top hospitals in the world, where there's a wonderful amount of knowledge when it comes to this field. So this Mass General Center for Global Health. Like I said, I obtained a Thomas Durant Fellowship, and I went that route. Spent 6 months in Haiti, where I came up with the idea of EpiCare. And there's a global nursing program and a global disaster response team that's also available to staff at Mass General if you're interested. Also, I've tagged a link here below for those of you who are interested to kind of explore and see what other resources are available to you. And I believe that is the last slide. Yeah.
Thank you, Mr. Roy, for a very inspiring talk and for sharing with us your background and some of the great initiatives you've been working on. I see here we have a few questions coming in, so I'll just start with the first question. How can we best support your efforts during COVID-19?
During COVID-19, definitely. All right, so again, this was probably the toughest year for us when it came to our response and our daily duties. And so what we've done was switch gears. And so we are moving on to online training for our junior responder program. So we're always looking for volunteers, whether it be to get these, we have the junior responder kits to get delivered to these students personally, or even volunteers who are familiar with CPR, who are instructors, to get involved and take on these courses and teach. Right, or going to our website and donating to the cause as well. But we also have a COVID grocery program where we're delivering foods to the communities that are most affected and mostly impacted by COVID. And so we're also looking for volunteers to help with the delivery or acquiring of goods, so that we can make sure that the goods get to the people that deserve it or need of it.
Again, we're still waiting for a few more questions, and while waiting, I'll just ask one question. I know you talked about EpiCare and starting that program. Can you expand potentially on the future directions of the program, and how can people help with that initiative or get involved and help support these efforts?
Yeah, definitely. So one of the initiatives that we have, and we're looking forward to start up, is a global health trainer program. We're always looking for nurses who are interested in this field. You don't have to really be a nurse, but someone who's interested in the field, who's willing to be educated and trained in some of these trainings to go out in these countries or communities to help deliver these trainings. I think it goes hand in hand when it comes to, you know, empowering individuals and making sure that these communities are receiving the same trainings, but also understand what is the cultural differences in that. And so individuals who are kind of, who are familiar with the community that we serve and who are looking to volunteer, you know, and deploy, if anything.
Thank you. And I know Joy also has a question.
Yes, the question I have for you, Harold, is you spoke about providing resources and programs that's sustainable.
Mm-hmm.
And having been involved with a lot of missions as I have, that's always the challenge of how to really do that and make sure it's effective.
Definitely.
With your program that you're having now in providing sustainability, have you reached out to the different groups and organizations that are on ground and tried to partner with them? And if you have, how is that going?
Yeah, for sure. So we have an Epicare Haiti team, and that team they partnered up with a grassroots organization. One of them is Wazoo, and they basically do the same thing that we're doing. But what their lack is that they don't have instructors to teach them the basic skills, you know, and so they always have to pay, which is always an issue where they don't have any money. So what we've done, we've partnered with them. They're more or less our sister organization. We meet with them. They tell us what it is that they're looking for, and we collaborate and we come up with a program that is useful for them in their environment, and we'll bring a team now to educate and train them. Right now, we're also working on a mobile app to kind of help update them on these refreshers and these trainings. And so once that is developed, actually we've partnered up with MIT. We have a student working on that app right now. Once that is developed, then we can kind of upload a lot of our training and do video conferences, so where we don't really necessarily have to go to Haiti to do these trainings, but we can do them remotely and kind of help them upkeep and refresh them if anything.
Thank you for sharing that. And then we have a few other questions coming in, specifically about the Epicare program. Here we have some.
Epicare grows. They have a hands-on to what's going on, but at the same time, the relationship here at the States, the drop.
About how when people just kind of bring in an NGO to a country, it can be totally against what the country wants, what the people want.
Yep.
So then, you know, as places like Mass General branches out into more global health, should we always be seeking members of the diaspora for whatever country or whatever project we're trying to go into, and then actually be partnering with local groups to then move into those international settings? Or should we go into those international settings and find people on the ground in the country who are interested?
Definitely. So that's a great question, and I think this is something that needs to be researched, because it's like you don't want to pick any diaspora to work with, because it all depends on where what I mean. It gets a little tricky, right? It gets a little complex in the sense where you don't want to have somebody that's going to go against the four principles of the humanitarian international organization, right? You don't want to have a diaspora who is part of the military, or he has family ties to the military, right? That'll go against, you know, those core values. You don't want to have somebody that come on board who's politically, who has political ties, right? Because that goes against the principles. So there is no process as far as identifying the ideal diaspora on how to recruit and how to what's the proper term I'm trying to say? Try to integrate them in a way that is beneficial for everyone, especially the community that you're trying to serve. It gets to a point where you need to really do your research and really try to filter through those diaspora to get the right individual, because you don't want to get someone who's really not familiar. Yeah, I'm Haitian American, but I've never stepped foot in Haiti, right? And you're taking me to Haiti, and now I'm representing this community who is not really going to be accepted because I'm considered, American, right, with my Western ties. So it gets really tricky. You just really have to find an individual who is a champion on the ground, who's well respected. And once you identify that person, having them come on board and understanding and getting a grasp of what the NGO process is, and you have that, you get that gem, then you're golden. But this is it's kind of difficult when you're trying to bridge the gap. So my goal is to educate those where we come across, let them know what the NGO's roles are, and let them know and have their voice being heard to the NGOs and vice versa.
Thank you for sharing that experience. I knew that Joy had another question. Joy?
The question is, it's a little off the, actually not, but a lot of times when there's conversation about humanitarian work, global missions, it's usually directed towards the medical staff, as you alluded to earlier, and not like technologists or IT and stuff. If IT, not sure anyone in a group today have the profession that's out of a nursing or a doctor. What would you say to an individual like a technologist or some administrative personnel who wants to be involved with something like that, but don't know how to because they think it's just for nurses and doctors? What would you have to teach them, and how would you direct them?
Oh, listen, if I had that mentality, I would never went for the Thomas Durant Fellowship. You know, I went there with an idea, with a purpose. I had a story, and had some support, and that helped me out. So networking and educating yourself a little bit about the humanitarian response in that field will hopefully clarify what it is that you really want to do. And so once you educate yourself in that field, then you can kind of go and approach and tackle that. And what you don't want to do is to just jump all in and you deploy somewhere, and then now you become a victim. Now you're wasting resources that could have been used as someone that really needed, right? So my advice would be just to take your time to do some research, explore, educate yourself on the field, and see if something that can kind of, tap into your niche. And once you grasp that, take that and own it, and then and make that your baby and run with it.
Thank you. And I'm seeing here just one more question coming in. For people who are interested in getting involved and helping out, is there a way to get involved remotely or other ways to get involved without traveling to Haiti?
Yeah, definitely. So we do a lot of work remotely. We have individuals who, let's say, for example, we have a grocery COVID program where we've received some funds to allocate groceries to deliver to families who are in need. We've partnered up with the Boston, the ABCD. And so ABCD gave us a list of families that are in need. And so what we do, we identify them, we send them a questionnaire listing the foods that they're available to them. We purchase that and we deliver it to their house, all while using PPE and stuff like that. So we're always looking for volunteers to kind of help in that sense as far as the grocery program. And also if translation, so we're not only at the Haitian community, we have Spanish, we have, Cape Verdeans. And so we're also looking for translators to help translate a lot of the training materials to make sure that everyone who's impacted, whether it be natural disasters, COVID, whatever it may be, they get the message, the much needed message to kind of keep themselves safe and their families. So yes, please. So if you guys are interested, please visit our website. Send me an email, and then we'll definitely find something for you to do.
So, Mr. Roy, thank you for a great presentation and for sharing with us your experience and how to get involved with this program. And I will invite everyone on the session to visit the website or email you for more information and on how to get involved.
I appreciate that. Thank you guys. Thank you guys for having me. And enjoy the rest of your day.
Thank you, Harold. That was really amazing. It really tireless energy that you have, and a lot of insight that you brought to a different aspect of our humanitarian and global initiative. And it's really global. It's not just Haiti.
No, it's not.
And really thankful for that.
Appreciate that, Joy. Thank you for having me.
Absolutely.
Carmen, if you can just go to the next slide, please. So to remind everyone, tomorrow we will be having a lecture again at noon with Dr. Jonathan Jackson, who is the Director of Community Access, Recruitment, and Engagement Care, the research center at MGH and HMS, which investigates the impact of diversity and inclusion on the quality of human subject research. So we hope to see everyone there tomorrow. And just one last housekeeping item, if you can go to the next slide, Carmen. For anyone who's looking to get CME from this lecture, the code to use is VAVTEQ. And if you can go to our website, you can fill out the form for physicians, nurses, and techs. Again, thank you for joining us, everyone, and we hope to see you tomorrow at noon.